Hi, I'm Dr. Kristin Turza, a general and colorectal surgeon at Augusta Health. Today I'm going to be discussing robotic cholecystectomy. Robotic-assisted surgery allows surgeons to perform many types of operations and procedures with more precision, flexibility, and control than is possible often with conventional techniques. As you can see here in this schematic, the robot arms are at the patient bedside. The surgeon controls the robot arms from the control console. How does the robot work? Small incisions are made. The robotic instruments are inserted. We use a high-definition three-dimensional camera to visualize the abdomen. The surgeon control panel allows the surgeon to manipulate the instruments, and the system responds to the direction that he or she provides. There are many benefits to robotic surgery. There's a greater range of motion and dexterity. We use a highly magnified, high-resolution image of the operating room field. There's a lower risk of infection. There's less blood loss and fewer blood transfusions. There's less pain, a faster recovery, and often quicker return to daily routines. Gallstones are very common in our country. About 10 to 15% of the population have gallstones. The gallbladder is a reservoir that stores bile. For various reasons, gallstones can form in the gallbladder. Symptoms that patients can experience include pain on the right side or around the back, nausea, and vomiting. Gallstones can cause inflammation in the gallbladder. It can cause a blockage in the bile duct or the pancreatic duct, and it can also lead to pancreatitis. Some gallstones, however, do not cause problems and don't require treatment. Robotic cholecystectomy is an outpatient operation. 3 to 4 small incisions are made on the abdominal wall. The gallbladder is dissected free and critical structures are identified and preserved. As you can see in this image here, we identified the blood vessel that brings blood to the gallbladder and the tube that drains the gallbladder called the cystic duct. We use clips on these structures and we divide them in order to remove the gallbladder. One of the main benefits to using the robotic instrumentation for gallbladder surgery is us being able to use fluorescence imaging to help identify these critical structures using indocyanine green dye. The patient receives an IV injection of indocyanine green, which is a safe medication. This binds to proteins in the blood and remains in the blood vessels. The near-infrared fluorescence technology on the robotic platform allows the ICG to be visualized in the tissues, as you can see here, and this helps us ensure that we can identify the common bile duct and other important structures that we need to preserve during this operation. In terms of recovery, patients frequently and most often go home the same day. Patients are encouraged to ambulate and perform basic daily routines. There's no significant restrictions in your diet. We tell people to avoid lifting over about 10 to 20 pounds for 4 to 6 weeks after surgery, depending on what your surgeon tells you. After about 1 to 2 weeks, most patients can return to work with lifting restrictions in place if heavy lifting is a part of your job. You can resume physical activities such as running, cycling, and light aerobics after about 3 to 4 weeks with appropriate caution if cleared by your surgeon. We look forward at Augusta Health Surgery to taking care of you, where the journey is personal.